See, gentlemen over 50 want to talk about something most men never bring up until they are scared. You stand at the toilet and notice your urine stream is weaker. You have to wait a bit longer to start. You're getting up to 3-4 times a night to pee. Maybe one day you see a small streak of blood. Maybe your erections aren't as strong or as reliable as they used to be. And you tell yourself, it's age. It's normal. I'll live with it. But here is the hard truth. Some of these normal changes can be silent warnings from your prostate. Warnings that you should not ignore. I'm Dr. Claire Monroe, Men Over 50 Specialist. In this video, I'm going to walk you through 5 silent prostate warnings that many men over 50 ignore and what they really might mean for your men's health. Stay with me until the end. Because knowing these signs early can be the difference between a small, manageable problem and a much bigger one that is harder to treat later. Section 2, what your prostate actually does and why the signals matter. Let's slow down and talk about what the prostate really is. The prostate is a small gland, about the size of a walnut in younger men. It sits just below your bladder and wraps around the tube that carries urine out of your body. That means when the prostate gets swollen, irritated, or grows in the wrong way, your urine flow often feels it first. You might think, if I can still pee, it's fine. But your body doesn't speak English. It speaks in symptoms. Changes in your pee, changes in your erections, new pain in your lower back, hips, or pelvis, blood in urine or semen, constant nighttime trips to the bathroom. These are not random. They're messages. Now, an important thing I want you to hear very clearly. Not every prostate symptom means cancer. Many men over 50 have a benign enlarged prostate. We call it BPH, or inflammation called prostatitis. These can cause very annoying symptoms without being cancer at all. But here's the problem. The early stages of prostate cancer can look very similar to these less serious problems or have no symptoms at all. That's why ignoring changes and hoping they go away is a dangerous strategy. Think of your prostate like the warning lights on a car dashboard. A little change in how you pee. A new pain that doesn't match an old injury. A leak you never had before. These are all small blinking lights. You can cover the dashboard with tape and say, I don't see it, so it's not real. Or you can say, my body is trying to tell me something. I should let a professional check under the hood. As a Men Over 50 specialist, I don't want you to panic. But I also don't want you to stay blind. The goal of this video is not to turn every symptom into cancer. The goal is to help you learn which quiet changes should push you to talk to your doctor or urologist. Sooner, not later. urologyhealth.org+1 in the next sections, I'll walk you through 5 silent prostate warnings that too many men over 50 ignore, often until the problem has become much bigger than it needed to be. The first silent warning is easy to brush off. You stand at the toilet and notice it takes longer to start. The stream feels weak. Sometimes it stops and then starts again. You finish, but it feels like the bladder didn't fully empty. You might laugh about it with friends. I pee like an old man now. But here's what might be happening under the surface. Because the prostate wraps around the urine tube, when it grows bigger, harder, or more irregular, it can press on that tube. Imagine squeezing a garden hose with your fingers. Water still comes out, but the flow is weaker, broken, or slow to start. That's what your bladder is fighting against. Sometimes this is due to benign enlargement. Sometimes it's inflammation. And sometimes, especially if it gets worse quickly, it can be a sign of something more serious. Either way, the message from your body is the same. Something has changed. Don't ignore me. I remember a man I'll call Michael, 67. He told me I have to stand there and wait for the pee to come. Sometimes I'm pushing so hard I get a little dizzy. But I figured I'm in my late 60s. That's just how it is. For years, he said nothing. When he finally came in, we found a very enlarged prostate and other changes that had been building slowly. He looked at me and said, I wish someone had told me that this wasn't just old man pee dot. So I'm telling you now, if you have a weak stream, strain to start peeing, notice your flow stops and starts. Feel like you have to go again right after you finish. Don't just joke about it. Write it down. Notice how often it happens. And talk to your doctor or urologist. Urinary changes are one of the earliest red flags for many prostate problems in men over 50. If you're a man over 50 and this is speaking to you, subscribe to this channel so you don't miss the next videos. We're going to keep talking honestly about men's health, prostate health, and confidence in a way that respects your age and your intelligence. The second warning sign is one that steals your sleep before it steals anything else. You start getting up at night to pee. At first it's once, then twice, then 3 or 4 times. You tell yourself, it's just water. I drink a lot at night. But if nighttime urination keeps increasing, especially if it comes with other changes, your prostate may be asking for attention. When your prostate grows or tightens around the urine tube, your bladder has to work harder. You may feel a constant urge to pee, like you never fully empty, like you have to rush to the bathroom, or you might leak a little. Over time, this can damage your sleep, your mood, and your energy. It can also hide bigger problems. Now let's talk about silent warning number 3, blood where it does not belong. Blood in urine. Blood in semen. Even a small streak. Even one time. Many men ignore this out of fear or shame. They think, it happened once, I'll wait and see. But blood in urine or semen is a red flag that should never be ignored. Is it always cancer? No. It can come from stones, infections, or other causes. But your body is not being dramatic. It is showing you a clear sign. Please let someone check what's going on. I had a patient I'll call Luis, 72. He noticed a little pink in his urine one morning. He was scared. So he did nothing. Months later, it happened again. Still, he waited. By the time he came in, we found serious problems that had likely been growing for years. He told me, I saw the warning, but I was more afraid of the doctor than of the disease. I don't want that for you. If you wake up many times a night to pee, feel like your bladder never empties, see blood in your urine or semen even once, please don't just push it down. Write it down. Tell your doctor. Ask clearly, could this be my prostate? Do I need a prostate exam or a PSA blood test? And if listening to this you quietly recognize yourself, type the number 1 in the comments. You don't have to explain. Just that one says, I know I've been ignoring some of this, and I'm ready to take it more seriously. The next warning is one many men over 50 file under, I'm just getting old. I'm talking about new, unexplained pain in your lower back, your hips, your pelvis, the area between your scrotum and anus. Sometimes it's a dull ache. Sometimes it's pressure when you sit. Sometimes it feels like you're sitting on a ball. Now, let's be clear. Back and hip pain can come from many things. Old injuries, arthritis, hard work over many years. But if you have urinary changes plus new pain in the pelvis, or pain that won't go away, or pain that feels different from your usual old injury pain, it deserves attention. In some men, advanced prostate problems can press into nearby structures and create deep, nagging pain. It may hurt when you sit. It may feel strange in your rectum. You may have pressure when you try to have a bowel movement. Again, not every pain is cancer. Sometimes it's inflammation. Sometimes it's muscle. But when your prostate, your urine, and your pain are all talking at the same time, you should not ignore that chorus. I remember a man I'll call Howard, 70. He shrugged off his pelvic pain for over a year. He said, I've worked in construction all my life, of course my back hurts. But his pain was different. It sat low, deep, and hard to explain. He also got up 4 times a night to pee. When he finally came in, bring that note to your doctor or urologist. Don't just say, my back hurts. Say, my back and pelvic area hurt and my urine stream has changed. Could this be my prostate? If this is helpful so far, hit the like button so more men over 50 can find this video. You might help another man notice his warning signs sooner before they grow into something much harder to handle. Now we're going to talk about a warning sign that many men keep completely silent. Changes in erections. You may notice, it's harder to get an erection. It's harder to keep one. Your erections are not as firm as they used to be. Your desire is down and you feel flat as a man. Most men blame this only on age or only on low testosterone. But sometimes, changes in erections can also be linked to changes in blood flow and nerve function. We had a much bigger fight on our hands than we might have had earlier. This is why I say to men over 50, do not ignore new, persistent, or strange pain around your hips, pelvis, or low back, especially when it comes with urinary changes. Write down where it hurts, when it started, what makes it better or worse, around the prostate and pelvis. Again, this does not mean that every man with ED has prostate cancer. Many things can affect erections, blood pressure problems, diabetes, medications, stress, anxiety, depression. But if you notice, erection changes plus urinary changes, or erection changes plus pelvic pain, or erection changes plus blood and semen or urine, your prostate health should be part of the conversation with your doctor or urologist. There is another layer here too. When erections change, many men feel a deep hit to their confidence. They may pull away from their partner. They may avoid touch out of fear of failing. They may start to feel less like themselves. This emotional weight can make it even harder to speak up about physical symptoms. But silence does not protect you. It only protects the disease. I want you to hear this from me as a men over 50 doctor. You are not weak for speaking up. You are wise. Asking, could my prostate be part of this, is not overreacting. It is taking responsibility for your health. And if the problem is not your prostate and is something else, you still win. Because you'll know what you're dealing with and what options you truly have. You deserve honest answers, not quiet suffering. If you're a man over 50, your prostate is part of your story whether you like it or not. Ignoring it does not make it disappear. Your body speaks to you through signals, and your prostate often speaks quietly at first. We talked about 5 silent warnings that many men over 50 ignore. Changes in your urine stream. Harder to start. Weaker flow. Stop and go urination. Feeling like you didn't fully empty. Nighttime trips and constant urgency. Getting up more and more at night. Feeling like you always need to pee. Rushing to the bathroom, sometimes leaking. Blood in urine or semen. Even one time. Even a small streak. This is never something to brush off. New, unexplained pain in your pelvis, hips, or low back. Especially when it feels different, deep, or linked to sitting or peeing. Changes in erections and sexual function, especially when they show up alongside urinary changes or pelvic pain. Any one of these is a reason to talk to your doctor or urologist. 2 or more together are a reason to talk to them soon. Here's what I want you to remember. These warning signs do not mean you definitely have cancer, but they also do not mean just getting old. They mean your prostate needs attention. Please don't wait until it's too late. Your next step is simple, but it takes courage. Write your symptoms down. How often you pee. How many times you get up at night. Any pain. Any blood you noticed. Any erection changes. Bring that list to your doctor. Say clearly, I'm over 50. These are my symptoms. I want to talk about my prostate. Do I need a PSA blood test? Do I need an exam or a referral to a urologist? MD Anderson Cancer Center plus when you are not being dramatic. You are being wise. If you're a man over 50 and you don't want to walk through this alone, subscribe and stay with me here. This channel is built for you, for your men's health, your prostate health, your sexual health, and your confidence as a man. And if you have a husband, a father, a brother, or a friend who jokes about old man pee, but secretly seems worried, share this video with him. Sometimes one honest conversation is what turns fear into action, and action into early detection. Before we finish, one important reminder. This video is for educational purposes only. It is not medical advice. Always talk to your own doctor or your urologist about your personal health, your symptoms, your medications, and your test options before making decisions. I'm Dr. Claire Monroe. Thank you for spending this time with me. Remember, aging does not mean staying silent. It means using your experience and your courage to take better care of the body you plan to live in for the years ahead. Before you go, I want you to remember this. If you're a man over 50, you don't have to figure this out alone. On this channel, you'll find a whole library of videos made specifically for you. Men's health, boosting testosterone, prostate health, erectile dysfunction, sexual health, and natural ways to support your body after 50. If you want real guidance from a doctor who works with men your age every day, hit subscribe and turn on the bell so you don't miss the next videos and the live sessions where I answer men over 50 questions in real time. And if there's something specific you're worried about, just type it in the comments, even a short message. I do read what you write, and many of the videos and live talks on this channel started with one man, just like you, asking for help. Your body is speaking. My job is to help you understand it. I'm Dr. Claire Monroe, urologist and men over 50 specialist. I'll see you in the next video and in the next live.